do we choose? Do we do one injection, multiple injections? What time frame between injections? I understand it's probably arbitrary, but any thoughts on if someone's, going down this line of designing a trial or just using this clinically? Should we do one injection, two injections, three injections?
Yeah, for me in the clinic, what I do if I have a horse with a tendinopathy, we'll do an ultrasound examine, longitudinal and cross-sectional, and then I'll have a quantitative amount of their lameness with what we call a lameness locator. So it's not just me saying, "Oh, you're better," or the horse as the owner saying that. So for me, when an animal comes in and I give them an injection, if they're not, and then I want to see them again 6 weeks later, 3 to 6 weeks later, depends on how soon they can get back here. It's not easy to get to Ithaca. But if they're not 50% better in every one of those parameters, clinically, on palpation, on lameness, and an ultrasound examination, if they're much better but not 50% better, I will give them a second injection. If they really didn't have a response, I think those are the non-responders. So I don't give them a second injection. Maybe they need something else. If they're more than 50% but not great, for those I'll give another injection. So that's how I frame it. One thing that we didn't talk about at all here is rehab and the importance of obviously weight control and rehab and all those things. And those are, you can fix the biology, but if you don't fix the mechanics, we're not going to get anywhere really.
And that's another black box, the effect of mechanical loading on the biology. How does mechanical load being rehab, joint motion, weight bearing, a whole nother topic portfolio, a whole nother day. But I think for the clinicians, it makes sense to, there's no one size fits all. And I think you need to have the ability to vary your injection protocol and schedule based on the patient's response.